Imagine waking up tomorrow morning and your mouth feels like sandpaper, your lips cracked, your tongue stuck to the roof of your mouth, your throat tight and rough before you have even said a single word. You reach for water, drink a full glass, and within an hour, it is back. If you are over 50 and this is happening to you regularly, what you are about to hear may be one of the most important things you listen to this year. Because that dry mouth is not a minor inconvenience. It is your body sending you a quiet, urgent signal that something deeper is going wrong inside you. In the next few minutes, I am going to show you exactly what your dry mouth and cracked lips are warning you about, which hidden conditions they are linked to, and the simple daily steps that can reverse the damage before it becomes something you cannot undo. Here is what most people do not realize. A dry mouth in the morning is almost never just about thirst or sleeping with your mouth open. After 50, your body's ability to regulate fluid balance, hormone signaling, and cellular hydration begins to shift in ways your doctor may never sit down and fully explain to you. The mainstream advice tells you to drink more water. That is not wrong, but it is dangerously incomplete. What nobody warns you about is that persistent morning dryness is directly tied to 3 specific internal processes, one involving your nervous system, one involving your blood sugar regulation, and one involving a silent inflammatory response happening in your salivary glands, and ignoring all 3 of them together is how small symptoms become serious diagnoses. The damage does not announce itself loudly. It builds quietly behind the scenes morning after morning until one day the symptom is no longer just dry lips. My name is Dr. Richard Wells, and I have spent over 22 years working with adults over 50, in clinical settings, in research, and sitting across from patients whose early warning signs were dismissed for years before someone finally listened. I am sharing this today because I have watched too many people come to me when the window for easy intervention has already closed. I have sat across from patients who looked at me and said, "Why did nobody tell me sooner?" I am done staying quiet about what dry mouth is really telling your body. Everything I share here is grounded in real medical research, explained in a way you can actually use. Today, you will learn the 3 hidden conditions that morning dry mouth and cracked lips are warning you about, the specific physiological damage happening inside your body right now if this is a regular symptom for you, and the clear, practical steps you can begin tonight to start reversing it. Stay with me through all of this, because the 3rd warning sign is the one most people never connect to dry mouth at all, and it may be the most important one of the 3. The first thing your dry mouth may be warning you about is one that most people brush aside entirely. They think dry mouth means they simply did not drink enough water before bed. That is understandable. It seems logical. But here is what is actually happening inside your body when you wake up parched every single morning. Your salivary glands are controlled by the autonomic nervous system, specifically the parasympathetic branch, which is responsible for rest, repair, and recovery. When you are chronically stressed, when your cortisol levels stay elevated through the night, your body shifts dominance to the sympathetic nervous system, the fight-or-flight branch, and the sympathetic nervous system actively suppresses saliva production. This is why your mouth dries out under stress or anxiety. You have experienced this before a difficult conversation or a medical appointment. Now imagine that state being your default setting every single night while you sleep. A study published in the Archives of Oral Biology confirmed that elevated nighttime cortisol significantly reduces salivary flow rates, particularly in adults over the age of 50, where adrenal regulation is already less efficient. In plain terms, your stress hormones are turning off the tap in your mouth while you sleep, and after 50, your body is slower to turn it back on. Think of your salivary glands like a garden hose. When the water pressure is correct, everything flows. Chronic stress is like someone quietly stepping on that hose in the middle of the night, every night, until the flow becomes a drip. I once treated a 63-year-old woman who came to me about persistent fatigue and recurring mouth infections. She had been waking up with extreme dry mouth for nearly 2 years and assumed it was just aging. What we found when we looked deeper was that her nighttime cortisol pattern was severely disrupted. She was spending the majority of her sleep hours in low-grade sympathetic activation. Her body was not resting. It was bracing. Her dry mouth was the first visible sign of a nervous system that had been in quiet crisis for years. Stop right now and honestly think. How often do you go to bed with something unresolved on your mind? How many nights this week did you wake between 2 and 4 in the morning for no clear reason? Comment that number below. You may be surprised how common it is, and how directly it connects to what you feel in the morning. The fix is not complicated. Begin with a 10-minute wind-down protocol before sleep. No screens, no news, no difficult conversations. Magnesium glycinate between 200 and 400 milligrams taken 30 minutes before bed has been shown to lower nighttime cortisol and support parasympathetic tone. And practice slow nasal breathing as you lie down. 4 counts in, 6 counts out. This directly activates the vagus nerve and shifts your nervous system out of fight or flight before you close your eyes. Now, the second warning sign is even more dangerous, and it surprises people because it involves something they assume only affects diabetics, not them. That assumption is exactly where the danger hides. The second thing morning dry mouth is warning you about is one of the most underdiagnosed conditions in adults over 50. Most people think blood sugar problems only show up as dramatic symptoms: dizziness, shaking, extreme thirst after eating. So when their morning mouth feels dry and sticky, they never make the connection. But that connection is one of the most well documented in metabolic medicine. When your blood glucose is chronically elevated, even at levels that do not yet qualify as full diabetes, your kidneys begin pulling extra fluid out of your tissues in an effort to flush that excess sugar through urine. This process is called osmotic diuresis, and it depletes your cellular hydration faster than any amount of normal nighttime respiration can explain. By the time you wake up, your mouth, your lips, and the soft tissues in your throat are already running on a fluid deficit. A landmark study in the journal Diabetes Care found that adults with fasting blood glucose levels between 100 and 125 milligrams per deciliter, a range called prediabetes, reported dry mouth symptoms at nearly twice the rate of those with normal glucose. And here's the alarming part. The CDC estimates that over 96 million American adults are currently in that prediabetic range, and the vast majority of them do not know it. After 50, the pancreas produces less insulin, insulin sensitivity declines, and this condition can develop silently over years, with dry mouth being one of its earliest and most overlooked signals. Think of it this way. Excess blood sugar acts like salt in your bloodstream, drawing water out of your cells toward it. Your body's tissues are being quietly wrung dry from the inside, the way a sponge loses moisture when you press salt against it. I once treated a 58-year-old man who came to me convinced his dry mouth was from snoring. He was a retired engineer, active, not overweight, and had no family history of diabetes. But when we ran a fasting glucose panel, his number was 1:18. He had been in a pre-diabetic state for an estimated 3 to 4 years without a single alarm being raised. His dry mouth was the first honest signal his body had given him. We caught it. Not everyone is that fortunate. Stop right now and honestly think, when did you last have a fasting blood sugar test? Was it more than a year ago? Comment yes or no below. Your answer might prompt someone else watching to check theirs. The fix is not complicated. Eliminate liquid sugars entirely. Sodas, fruit juices, sweetened coffees. These spike your blood glucose faster than almost any solid food. Add a 15-minute walk after your largest meal of the day. Research published in Sports Medicine shows this single habit lowers post-meal glucose by up to 22% in older adults. And consider having your HbA1c tested. This is a 3-month average of your blood sugar levels and far more revealing than a single fasting reading. Your doctor can order it with a standard blood panel. Now, the third warning sign on this list is the one that genuinely shocks people because it has nothing to do with stress or sugar. It is a condition most people have never heard of, and it is far more common in adults over 50 than you would imagine. What it is doing to your body goes well beyond a dry mouth. The third thing your dry mouth is warning you about is the one doctors most frequently miss. And it is the reason I feel the strongest urgency sharing this today. People assume dry mouth is always a symptom of something else: stress, sugar, medication side effects, and those are all real. But there is a condition called Sjogren's syndrome, an autoimmune disorder in which your immune system mistakenly attacks your own moisture-producing glands, your salivary glands, and your tear ducts. And it disproportionately affects adults over 50, with women being significantly more vulnerable after menopause due to the dramatic drop in estrogen, which plays a direct protective role in immune regulation. The process happening inside your body with Sjogren's involves inflammatory cytokines, specifically interleukin-6, and tumor necrosis factor alpha, infiltrating the glandular tissue and triggering lymphocytic destruction of the cells responsible for fluid secretion. In plain language, your own immune system is dismantling the infrastructure that keeps your mouth and eyes lubricated, and it does it so gradually that many people spend 5 to 7 years with symptoms before they receive an accurate diagnosis. Think of your salivary glands like a small but essential factory. Sjogren's is like a silent fire that starts in the break room, small, slow, and undetected, until one day the factory floor is damaged and production has nearly stopped. I once treated a 67-year-old woman who had been told for years that her dry mouth and dry eyes were simply the natural effects of aging. She had accepted it. She had adapted her entire life around it. When she finally came to me for something unrelated and I ran an ANA panel and Sjogren's specific antibody tests, anti-SSA and anti-SSB, her results came back clearly positive. She had been living with an undiagnosed autoimmune condition for an estimated 6 years. Early intervention could have meaningfully reduced the progression of her symptoms. By the time we found it, the glandular damage was already moderate. Stop right now and honestly think, do you also wake up with dry, gritty, or irritated eyes alongside your dry mouth? Do your lips crack repeatedly even when you stay well hydrated? Comment the word both below if you experience dry mouth and dry eyes together. That specific combination is a clinical red flag that deserves medical attention, not reassignment as normal aging. The fix is not complicated, but it does require professional confirmation. Ask your doctor specifically for an ANA blood panel and Sjogren's antibody testing, anti-SSA and anti-SSB. Do not accept it is probably just aging without a test. In the meantime, use a preservative-free saline mouth spray throughout the day. Increase omega-3 fatty acids through fatty fish or a high-quality supplement to reduce systemic inflammation and ensure your bedroom has adequate humidity. A dry sleeping environment dramatically accelerates glandular dehydration in susceptible individuals. Let us bring this together clearly. If you are waking up with a dry mouth and cracked lips regularly, your body may be warning you about one or more of 3 things: chronic nighttime cortisol elevation, quietly suppressing your nervous system's ability to recover while you sleep; blood glucose dysregulation, pulling fluid from your tissues in a process your doctor may not have tested you for recently; or a silent autoimmune response targeting the very glands responsible for your hydration, comfort, and oral health. If you have been living with these symptoms for months or even years, it is not too late. The human body has a capacity for recovery that genuinely humbles me after all my years in medicine. The cells that were damaged can begin to heal. The systems that fell out of balance can be recalibrated. What matters is that you stop accepting discomfort as inevitable and start reading it as communication. Think about waking up tomorrow morning and taking your first breath without reaching frantically for a glass of water. Think about the feeling of soft, comfortable lips, a clear throat, a mouth that is ready for the morning. Think about what it means to move through your day without that low-level distraction of dryness, that quiet signal your body keeps sending because nobody has answered it yet. That is what this is really about. Not just hydration, but your comfort, your confidence, and your right to feel well in your own body at every age. I want to hear from you. Did any of these 3 warning signs match something you have been quietly experiencing and never fully connected to your dry mouth? Leave your answer in the comments. I read every single one, and I mean that. Subscribe to this channel. Every week I share medically grounded, Plainly explained health information for adults over 50. The kind of information that should be in every clinic waiting room, but often never makes it there. If this helped you today, hit the like button so more people can find this before their small symptoms become large diagnoses. Write the word listening in the comments right now. Your commitment to your own health may be exactly the encouragement someone else watching needs to take their symptoms seriously. And please, share this with someone you love. A partner, a parent, a sibling, a friend who keeps a glass of water beside their bed every single night. You may never fully know whose life you help protect by doing that. This is Dr. Richard Wells. Take care of your body. It has been trying to take care of you all along. Pay attention to what it is telling you.